So we are ready to start with our first panel. Our first panel, we'll be hearing from 4 nonprofit leaders from across the state and their experiences with COVID-19 and response on the ground. So it's very exciting for me to start with Marisela Morales, Executive Director of the Central Coast Alliance, United for a Sustainable Economy, or CAUSE.
Good afternoon.
Welcome.
Thank you so much to the Assembly Chairwoman Rivas and Senate Chairwoman Limon for this really historic day to have this first joint hearing of the select committees. Thank you for the members of both committees for sharing how directly connected you have been to the nonprofit sector. My name is Marisela Morales, and I have the honor of serving as Executive Director of CAUSE in Ventura and Santa Barbara counties, and also as Chair of the California Association of Nonprofits Board of Directors. And I want to share briefly that our board has representation from throughout the state, is majority people of color. I want to share just a special shout out to Assemblymember Gibson. I moved from Compton to Ventura County when I was 4, and still have family there. So the Cal Nonprofits is really connected throughout the whole state, and we're here to serve the nonprofit sector and to be in partnership with all of you. So first of all, I wanted to take the time to just share some brief, quick highlights about how critical the nonprofit sector is to California. Collectively, we provide about 32% of Medi-Cal services. So that's one example, specific example, as was said, about how critical the partnership between nonprofits and California government is at all levels. I want to share in terms of being an important key employer. The nonprofit sector is the 4th largest employer in California and is leading the way in terms of diversity, equity, and inclusion on its staff. 63% of the workforce of nonprofits are women. 29% of nonprofit leadership are people of color, compared to 12% in the general workforce. And in terms of board leadership, 56% of nonprofit boards include women, and 27% are people of color, compared to 16% in the for-profit sector. So the nonprofit sector is inclusive and a key employer in the state. We contribute to the state's economy. So nonprofits bring in, as one example, more than $40 billion into California from out of state. And we generate 15% of the California state product. I want to move closer to home in terms of some examples of how nonprofits have stepped up during the pandemic, drawing from our particular experience as a nonprofit CAUSE in the Ventura, Santa Barbara County area. First, in terms of vulnerable communities, people who are really on the margins and underserved, of course, increased demand. 2 examples, youth. Youth have been saying for years how mental health is a top priority. During the pandemic, we continued to organize youth for a collective voice, and the youth were able to win increased counselors. So important to their mental health, especially during the pandemic. Undocumented workers, COVID brought to the forefront that they are barred. They are locked out of unemployment insurance. And during the pandemic, undocumented workers were the hardest hit by job loss. Immigrant women in particular were the hardest hit. And working with other nonprofits, we launched officially as a nonprofit itself, the 805 and Docu Fund, which distributed over $5 million in direct relief, financial relief, to undocumented workers who lost their job and were ineligible to California unemployment insurance. And we're working with other nonprofits statewide to fix that injustice, and look forward to your support in that. Keeping democracy alive and how we've stepped up. So as an organizing and advocacy organization, We helped to keep democracy alive during the pandemic when everything was shut down, including public meetings physically. We taught youth, young adults, and adults how to use Zoom, how to, what is the process for the school district, the city council, the county supervisors, the state legislature to speak up even during the pandemic and participate in the democratic process. Lastly, nonprofits continuing to step beyond their mission. In our case, we are an organizing and advocacy organization, and yet we stepped up to do direct service to help people sign up for the vaccine and get the necessary resources they need during the pandemic. Thank you very much.
Thank you, Maricela. Next, we will hear from Carmen Padilla, representing El Concilio of Stockton.
Good afternoon. My name is Carmen Padilla, and I'm the Chief of Staff at El Concilio, California. El Concilio is a nonprofit multi-service agency currently serving San Joaquin, Stanislaus, and Contra Costa counties, with a mission to uplift and advocate for our underserved communities by providing critical services and resources. We want to thank you for this opportunity to share our experience during this pandemic. Our organization has been serving our community for over 54 years, and the pandemic has highlighted that we are a trusted resource in our community and a messenger, and we are also essential first responders to our community. Our organization had to act quickly and devise and strategize and create a plan of action in order to continue to provide the services to our clients and our community. We realized quickly that we had to take the resources out into our community and that we couldn't wait for our members to come to us. The first thing we had to do was to address the digital divide. We had moved some of our services to digital, and so we had to make sure that our members were able to access that. So what we had to do is we had to help create email addresses, had to provide education on how to access Google Meets and Zoom meetings to make sure that our community was able to continue to access these critical services that they needed. We also distributed laptops and also sent out mobile hotspots to areas that were needed in our community. We also led various grassroots efforts in our community by providing information on COVID-19 and resources in partnership with many local nonprofits. The first thing that we did, we organized many pop-up vaccine and testing clinics at our offices, at local grocery stores, at places of work, at local ranches, outside of schools. We actually took the resources to the people and met them where they needed and also at the times that they needed. We ensured that these clinics were provided outside of work hours and on the weekends to make sure everyone had access, as not everyone has the luxury of taking time off during the normal working day. We also were able to provide translation services and were able to help our clients fill out forms and answer questions in their native language. And we also helped ease their hesitancy for our undocumented and our uninsured community members. In addition to that, we also created an ACT task force where we met weekly with other nonprofits in our community with the focus on reaching our farm worker community to provide access to vaccines and testing, as well as education for this community. At our first ever testing site, we had an overwhelming demand where we had 600 people show up to a grocery parking lot. And so we realized that the need was critical. And so we have vaccinated over 6,000 people and provided testing for over 4,000. We also noticed that there was started to be a critical need in food insecurity. So we established a food distribution program where we set up a weekly food drive, and we were able to distribute over 8,000 food boxes. We also established a COVID outreach team that provided COVID outreach education. And we have our UCLA Get Out the Vaccine team that has canvassed over 2,000 hours knocking on doors in our communities were our most impacted zip codes, as well as our Sierra Health Get Out the Vaccine 58 that has called over 9,000 people trying to answer any questions pertaining to vaccine safety, or also informing them of our next vaccine clinic locations. We also have a medical transportation department that was able to provide transportation access to those that didn't have access to attend a medical appointment or attend a vaccine clinic. In conjunction with the city of Stockton, we also operated the emergency rental assistance program, in which we were able to help renters with utility and rent assistance, as well as provided eviction prevention education. We were able to distribute $36 million in funding to over 5,000 households. In addition to that, we were also able to distribute $1 million in assistance to our undocumented community who was left out of our first stimulus provided by the government, to try to help them and provide some relief. One of the challenges that we have faced and that we've encountered is the lack of flexibility on some of our state contracts. For example, when the COVID shutdown occurred in March, we submitted some budget modifications and budget questions to the state regarding our preschool programs. We didn't receive an answer to those until October, which kind of created some uncertainty and allowed us to have to cover some upfront costs, as we decided to keep our preschool doors open to provide daycare services to our essential workers in our community. We were fortunate enough that our operating budget allowed us to have a rainy day fund that we decided that the pandemic called for an opportunity to use those funds until we received the questions to our budget concerns regarding reimbursements, rates. So we are very thankful for the work that we get to do every day in our community, and also all the partnerships with our local nonprofits. The pandemic has exemplified that we are trusted messengers, and that we are able to take the lead in grassroots efforts and actually help the most vulnerable in our community. So as we go back to normal, whatever that case may be, we want to emphasize the importance of continuing to work with our nonprofits, as we have showed the ability to reach our communities and help those most impacted by the pandemic. Thank you very much.
Thank you. Next, we'll hear from Karen Delaney, Executive Director of the Santa Cruz Volunteer Center.
Chairwoman Rivas, Chairwoman Limon, committee members, I'm honored to be here to share some of the lessons we learned from our responses to the pandemic and the CZU fires, which happened at the same time. Our center is the home to about a dozen impact programs, so we do direct services, and we also work to connect 300 local nonprofit partners to volunteers and community resources. Most of these are the small grassroots organizations that are the backbone of our community. So I'd like to talk with both hats on. Nothing symbolizes how great we are at moving quickly to overcome barriers to service as these masks. Early supply chain issues and lack of PPE, because we often are under-resourced. We crowdsourced this. We delivered our first 1,000 masks to our public health and new shelter partners within a week. We stopped counting at 20,000, I think. We transitioned our counseling centers to telehealth, our food programs where people came to us and ate a meal, to drive-through meeting, our senior transportation programs to food delivery programs. As you're hearing a lot, this adaptability to meet people where they are is not unique to us. It's a core competency of the nonprofit sector. And I really thank the committee members for stepping in and helping with this issue about getting some flexibility in contracting. It is really critical to our success. Now, it's our people who delivered these results. At a time when we were reinventing everything about ourselves to meet critical needs, we also were laying off 5% of our staff. We enacted a 1-year wage freeze, and our staff, on top of that, took an additional 10% furlough to save the jobs of 3 more coworkers. Without sustained investment in the ability to pay fair wages for our nonprofit workers by funders at every level outside of disasters, there's no way we can thrive and be ready to respond during the next disaster that we all know is coming. I do not know a single small or mid-sized nonprofit in Santa Cruz County or on the Central Coast that is not struggling like we are to fill vacancies and pay a fair wage in these high-cost counties. Local nonprofits, as I agree, as many have said, have deep community roots, and we're trusted people, particularly by folks who are higher risk or hard to reach in a disaster. Access to these deep root networks are a win-win for our state and federal partners, as well as for our folks. And one example of this, we had a pre-existing relationship with the Office of Emergency Services when COVID hit. In the 2 weeks California was closing down, we were able to reach out to our collaborative partners so that when schools closed in our community, in our two largest Spanish-speaking school districts, Pajaro and Live Oak, when every parent who was Spanish-speaking showed up to get their packets and technology, they were also met with someone to be given COVID guides in English and Spanish. Keep your family COVID safe. We were able to work with food providers. So as everybody was delivering food, Meals on Wheels, these trusted partners delivered information that we were able to broker in. As we were working with our county to set up mass vaccine sites, we saw our nonprofit partners not only signing people up, but offering pop-ups, bringing people to the site. We had a quick call list. If there were extra shots at the end of the day, we would call our nonprofits and they would bring folks. Most small nonprofits would love to do more of this, and they would be a powerful force for equity. But even when there's state funding available, they can't afford, they don't have the capital on hand to start up these new services. Now, we're lucky enough to have a credit line, but this year, the first $20,000 my nonprofit raised is not going to my staff or to increasing our services. It's going to pay debt on our credit line while we wait for reimbursement on state and federal contracts. And that is an unnecessary business barrier to effective partnerships that we hope we can work together to remedy. Now, in addition to the staff labor market issues nonprofits are facing, with my volunteer center hat on, I want to talk about the volunteer labor challenge. As in-person services are reopening, most local nonprofits are finding that 25 to 40% of their volunteers are not returning, and the largest group of lost volunteers are in our elders. Now, the great news is that there's a heightened interest in volunteering, particularly among millennials. But we have an infrastructure crisis in local nonprofits. They lack the technology, the training, and the tools to engage this younger volunteer workforce who have pretty high expectations. It's not an issue that's going to be solved by a call to service or an online state registry, because the problem isn't that we need more people to want to volunteer. Every small nonprofit we work with is struggling right now with staff vacancies, increased demand for service, old computers, stagnant donor bases, and aging technology. So the resources they need to onboard and equip these new volunteers, they just don't have them. And these reasonable and modest infrastructure costs, a new computer, a simple app, the cost to background check and insure volunteers, they look like overhead in budgets. And so they're difficult to sell to the donor and philanthropic community. But smart, small investments to build this capacity throughout our volunteer consuming nonprofit network would pay huge dividends and increase donations of time, talent, and funding for our frontline local workers. And imagine how much more ready we would be to meet future challenges that are sure to come. Because this new interest in volunteering, if we don't capture that now, we're not going to be able to get it back a year from now or 2 years from now when the next disaster is already here. So I thank you for considering our perspectives. I thank you for recognizing the value of volunteers. And I look forward to working together to create the thriving and sustainable communities that we all deserve.
Thank you, Karen. Our final speaker on this first panel is Janet Marinaccio, CEO of MEND, serving the San Fernando Valley. Welcome, Janet.
Thank you, Assembly Chair Rivas, Senate Chair Limon, and the members of the Select Committee for this opportunity to address you today. I'm so honored to serve as President and CEO of MEND, which has served the San Fernando Valley for more than 50 years. COVID hit our valley hard, particularly the communities that are home to people who struggle the most, even when there's not a crisis like COVID, those who are unhoused or live far below the poverty line. At one point during the peak of the first wave, Pacoima, where MEND is located, became the epicenter of infections in LA County with the highest case rate per 100,000. Many of the people we serve, while they may be sheltered, would meet the federal definition of homelessness. That is, they live in conditions unfit for human habitation. They live in garages, lean-tos, crawl spaces. They're doubled and tripled up. They don't get counted during the homeless counts. So most people don't even know they're there. The valley doesn't have a skid row. We're seeing more encampments, but poverty is largely hidden. Our community nourishment programs, which include a food pantry and food bank, saw increases in demand as high as 400% compared to non-COVID years. The need remains high as grocery prices skyrocket, and any improvements in the economy have not trickled down to them. Paradoxically, this crisis has also afforded MEND incredible opportunities to serve our community in a more robust way. For example, CARES Act funding was deployed to enhance our food distributions and provide on-the-ground information and resources to people who are struggling with COVID's physical and mental health effects. And more dollars came after that from private, local, state, and federal sources. Because of the flood of money, government entities like LA County, for example, subcontracted with intermediaries to distribute the grants. Some had never managed public funds, leaving them with a big learning curve and a very short window to get the dollars out. And agencies like ours found themselves accepting public funding for the first time, scrambling to set up systems to manage the dollars efficiently and effectively. Despite these capacity changes, because of these additional investments, we were able to expand our reach, employ more people, serve even more community members, and breathed a little easier. Since the start of the pandemic, we have served our community through 1.6 million service encounters. We've distributed over 6 million pounds of food, 60,000 PPE kits, and through partnerships with vaccine providers, we have so far facilitated over 4,600 doses. Through 750,000 encounters, we put the food on the table of families, most of whom used a food pantry for the first time and might otherwise have gone without. So what keeps me up at night is wondering what's next. What happens when it's all over? Our board and I regularly talk about the impending funding cliff. How do we ensure the services people need to recover are there when additional funding goes away? What happens when there's another emergency, a wildfire, an earthquake? How do we deploy services if our own facility is damaged? As a result of these questions, our current strategic plan is grounded in building the resilience of our organization and our community so that we are ready for the next crisis. In order to do that, ongoing investments in this sector are required to continue to build the capacity we need to achieve this goal of resilience. People need access to good, well-paying jobs, including our own staff. It's hard to keep up with the increasing and justified demand for higher wages when the funds awarded to nonprofits have largely remained stagnant. I know the next panel will talk about recommendations for the next emergency, but I want to urge everyone to remember that communities like the ones we serve struggle daily. Poverty is an emergency. Homelessness is an emergency. For them, the next emergency is tomorrow, and the next one the day after that. Life in poverty is a series of micro traumas of shame, guilt, embarrassment, fear that accumulate, keeping people in survival mode. We can no longer look at homelessness as a monolith. There are people who are sheltered but not housed, who may need nothing more than access to opportunity and a fair wage to make that next step. We must prevent those at risk from falling into deeper crisis, and those who are already in deep crisis need to be lifted out even before the next emergency. The effects of this pandemic will not end the day the CDC declares it is now endemic. The economic and personal injuries will carry on for some time to come. We can't forget these daily struggles as we begin to go about our business as usual, and we can't forget to strengthen the safety net that is the nonprofits that are here to serve our community. Thank you so much for hearing my and my colleagues' remarks today.
Thank you, Janet. Thank you for reminding us that some of our communities are already in a state of emergency and have been and will continue to be because of poverty. And so thank you. Thank you to all the panelists for sharing your experiences and your recommendations. I will now open it up to questions from the members on the committee. Assemblymember Gibson.
Thank you very much. That was a mic drop from Janet. I think she hit all the points. And I think that we should ask ourselves what keeps us up at night. And if you don't have a problem with sleeping at night, then I think you need to make some reassessments in your own community, because I know and I have heard what Janet said would keep her up at night. It's the same thing that keeps me up at night when a child doesn't come home. When we get a call from Justice for Murdered Children or Parents of Murdered Children, which is a nonprofit organization to go and stand with parents who have lost their children to gun violence in Los Angeles. And so those, and as Janet are well articulated, those are the things that should keep us up at night. And I think that it's our responsibility to hear the voices of all the panelists, and I want to appreciate each and every one of them for speaking. And I look forward to the part that we get to the real solutions, how to address this, because you should not have to max out your credit card and waiting for state and federal funds to come, because you never can foresee a disaster or an emergency that comes up as a nonprofit, and then you don't have money in order to make ends meet. And it's the same thing that people are struggling with even in their own household accounts, right? Robbing Paul to pay Peter. And I think that we should put our money where our mouth is. We should look at how do we make sure that checks are generated in a very responsible in a thoughtful time, so these nonprofits can get the money that they have already expended and support it in ways of supporting the community, undergirding the community. So I look forward to that robust conversation, because I have some questions at that particular time. And I think, as I close, what keeps you up at night?
Thank you, Assemblymember Bennett.
Thank you very much, Chair Rivas. I do have two pretty specific questions for the nonprofits. One, earlier, a few weeks ago, we were crafting a bill to try to make sure that nonprofits qualified like businesses for all of the grants, et cetera, that are out there by the state. And we got pushback saying that's already the case, that we don't need this legislation. So I would just like to ask the nonprofits, if you have experiences where you're applying for grants and you're being told, oh, if you were a business, you could get it, but as a nonprofit, you can't. If you could contact my office and let me know, because that's a piece of legislation I would like to make sure we introduce if we need it. But at this point in time, committee staff has indicated that we don't. The second thing is more philosophical, but if you look at the United States, we have always honored the small farmer. We've always honored the small business person. And those entities are pretty easy to win support for politically when it comes to funding, et cetera. We just somehow have not found a way to elevate nonprofits to the same status. Everybody likes them, but we don't think about them when it's like, oh, we have this economic problem. We think about, what are we going to do for small business? We ought to say, what are we going to do for small business and nonprofits at the same time? And if everybody, the talented assembly members that I serve with and senators can all help me think about how we do that, I'd really appreciate that response. Thank you.
Senator Becker.
Thank you. I just want to mostly just echo what we heard from my colleagues, and just to thank all the speakers for the work that they and their organizations and countless other nonprofits have done during the pandemic. Thanks for that compelling testimony. I look forward to discussing some of the solutions going forward.
Okay. Senator Limon.
Thank you. And I think that was really important. I heard a few things that have been themes in the last 2 years that I do think need addressing, and I want to point those things out. We heard issues related to the 0 to 5 age, preschools, childcare, which continue to be an issue. I know that when you speak to them, they feel like they're the last in line to hear what the guidelines are, how to go through the process. And so that feels like something that's been echoed really across the state. We heard about the importance and flexibility in contracting over and over and over. During an emergency, we have understood that in order for our nonprofits to adapt, they need some flexibility in contracting. We have had to adapt our own jobs, so I think it should be expected that others will need the same thing. And as a state, especially if they're contracting with the state, that's something that we must recognize. And I know that, again, Assemblymember Rivas actually referenced a letter that went out early in the pandemic that several of us, signed on to and were part of that asked the state to do that, and the state did. But certainly, if there are elements where we could do a better job of providing that flexibility in contracting, I would be very open to hearing about that. The waiting for reimbursement and going into debt is I think just really heartbreaking, and I think Assemblymember Gibson referred to that, but that is a huge problem. Asking our nonprofits to go into debt because the state is lagging on our reimbursement, I hope is something that we can look into as a legislature. We have to be able to help our nonprofits survive, and what the wait periods are, why there are such long wait periods to get those reimbursement from the contracts, I think would be important for us to understand. I both was worried but also optimistic about the comments related to the volunteer labor challenges. The fact that we're losing 25 to 40% of our volunteers, who tend to be mostly elders, when we know that also the pandemic has forced, for health reasons and safety reasons, for all of us to be more careful. But certainly that is something that is that we need to be aware of, that we're losing volunteers. But I was optimistic when I heard that millennials are the ones that are like, sign me up, I want to volunteer. And so I hope that we could also learn more about that, about what are the ways that we could support that. We could, whether it's supporting it individually or if there are legislative tools that make it easier for millennials to volunteer, that's something that I would also love to learn more about. So those are some of the themes. What was mentioned today is not, they're not isolated themes. Like I know we've heard this, I've heard this, these themes really come up as well as you talk to nonprofits across the state. And so I appreciate that our nonprofits still hang in there, knowing that there are some challenges, and hope that this allows us to further look into some of these issues to see how the state could be a better partner. Thank you.
Thank you, Senator Limon. I want to add on to what my colleagues have already brought up as issues and some of the things that we heard. But one thing I thought about when we're talking about the lack of flexibility on state contracts, that we also have to acknowledge that sometimes these contracts do not cover the full costs of the services that are delivered. Nonprofits have to have fundraisers, their fundraising galas and appeals at the end of the year to cover the gap. And it feels that we're not valuing their services, the services that they are providing to our constituents across the state, because we're not paying them enough to do it, right? And so I hope that we think about that too. It's like, what is the cost to deliver these critical services in times of need, especially? I thought about what Janet was saying about the funding cliff after COVID-19. What happens when the CDC declares this pandemic over, but there's still a huge need in our communities? And how do we continue to provide that support to get people back on their feet, back into jobs, children into preschools, et cetera. And so I hope that we, as a legislature, continue to press for those much needed services. And as far as volunteers, when Karen was talking about volunteers, I thought of my own experience during the pandemic. My office got so many calls from constituents that wanted to volunteer. They wanted to help. They didn't know how to or where to go, but we constantly got calls from hundreds of constituents that were ready to go. But when Karen talked about the costs to onboard volunteers, right, background checks, everything that's considered overhead, and as a former nonprofit executive director, that's unfortunately a bad word. You don't want all your money to show up as overhead, right? We want it directly to program services because our funders demand that, right? They want the highest percentage of your budget to be allocated to program services, but this is a program service. So how do we work with the funding community, including the state? How do we work to make sure that we are able to onboard all of these volunteers, train them, and help us with the much needed services that we need during a state of emergency? I had one question for Karen Delaney of Volunteer, the Santa Cruz Volunteer Center. I want to ask, what can we do to help volunteers be prepared for times of crises? And what do you find as the most effective way of using people's growing desire to volunteer during the pandemic?
Thank you, Assemblymember Rivas, for that question. There's when there's a community, there's about 20 communities in California that have an organization like ours, a strong volunteer connecting organization. Hands On LA, Hands On Bay Area, the Volunteer Center of Sacramento, the Volunteer Center here, sometimes it's a United Way. And so there's a great unevenness for communities like ours that are lucky enough to have an organization that can pay for the website and the technology and help connect people. That's a leg up. So one of the things we can do is to try and put some infrastructure, and I'm using that term, the infrastructure of making it easier to connect locally, and the infrastructure of helping nonprofits. So helping it, a little bit of infrastructure goes a long way to make it easier for people to connect to where the help is needed. And that's a local or regional effort. The other thing, though, is when we're recruiting millennials, when we're recruiting younger volunteers, this onboarding cost, I think that, as you pointed out, it has to be both sides of the equation. We have to get better technology. One of the members mentioned broadband. We have to get better technology and access to free, quick background checks. Something like Texas has a volunteer fast pass that they pay for, where once a volunteer gets their free records, they can take that from and be onboarded quicker. So there are real simple solutions that will help make this process easier. Right now, all of the costs are on the local nonprofits who just don't have the capacity to respond.
I agree, and thank you for your ideas and your answers. Next, we're ready to move on to our next panel, our final panel, that is identifying future opportunities to support nonprofits during emergencies. We have 4 panelists that will each speak to us for 5 minutes. We'll start with Jan Masaoka, CEO of the California Association of Nonprofits, or Cal Nonprofits.
Thank you very much, Assemblymember Rivas and Senator Monique Limon. You know, it is really amazing that we're all here today with these two committees having been formed and leading, and it's so heartening to us nonprofits to see how many members there are who are interested in coming together and making the best use possible of California's nonprofits. Just a couple words first about the California Association of Nonprofits, or we say Cal Nonprofits for short. We are a membership organization with more than 10,000 nonprofits that are members, and we act as kind of a chamber of commerce for nonprofits. Mostly what we're doing here is to protect and enhance nonprofits' ability to serve our communities and also to contribute to our economy. And all of you, both the speakers as well as members of the two committees, have really spoken to understanding the importance of both of these aspects. Just recently we were an outreach partner for the California Small Business and Nonprofits Relief Grants as well as Cal Venues. The inclusion of nonprofits in these programs was something that we are very grateful for legislators who made sure that we were included, even though that may not have been in the early draft. So again, we're addressing your comment, Mr. Bennett. We really appreciate that. Speaking out from our legislative allies. In the last year, we've had 31 town halls and webinars, some of them with more than 1,000 nonprofits participating, in which people can learn and talk. Many of you have also, many members of the legislature and boards of supervisors have also participated in these town halls and webinars. And as you know, with the two select committees, we also are holding California Nonprofits Day, in which legislators are invited to honor a nonprofit of the year in their districts. And last year, 114 out of 120 legislators chose to name nonprofits of the year, which is very exciting. And even more exciting is that this year we're going to be back in person on the Capitol lawn on June 8th. So supporting nonprofits supports California, and I think many of these things you've just heard, that we are heroic first and second responders, that we're part of we are really a crucial part of the supply chain for services in California. When we hire locally, we spend locally, and we keep all the jobs local. We don't relocate to another state. We can't. Our highest paid jobs are more often held by women and people of color than in the for-profit sector. And as has been mentioned, we bring in $40 billion a year from out of state, including from the federal government, from out-of-state foundations, as well as from the individual donors all around the world who are so admiring of California's innovative nonprofit community. And as Karen mentioned, we leverage the economic equivalent of volunteers. In California, the equivalent of 331,000 full-time jobs are that work is done by volunteers in California. So these are all important ways that supporting nonprofits ends up having a very high multiplier effect. So we've been talking about the pandemic, but as other speakers have mentioned, we have a lot of normal, if you will, emergencies. We've all had earthquakes, wildfires, mudslides, and drought. These are kind of our usual emergencies that are always going to continue to come up. So these are some of the highlights for what we really need to be able to do the work that we do. First is just recognizing the power of government relief. You know, in just the first part of the California Small Business Relief Program, in which we were a partner, more than 800 nonprofits received grants of more than $98 million. And when you think about how many, all the work that Concilio and Cause and these other organizations have done, a lot of it has been because they were able to get that kind of funding that just wasn't available, even though foundations and individual donors were much more generous in stepping up. They can't match the power of government to do this kind of work. Secondly, we need relief programs that are understandable. In the first set of applications for the relief program, the first question was, what is the name of the owner? You know, that's a phrase that kind of made nonprofits think maybe I don't belong here, because of course we nonprofits don't have owners. We are owned in effect by the public. So we need relief programs that speak the language of nonprofits and make sense to them so that they can successfully fill out the applications. As several people have mentioned, we need contract flexibility. Sometimes, for example, we have to keep our child care centers open for the children of emergency workers, but we are not able to meet, for example, the deliverables of the normal attendance rates upon which our contracts was delivered. And in other times, we have to quickly be able to move money from one thing to another. We saw lots of health clinics having to move large amounts of money into masks and safety equipment without having to go through an often laborious and time-consuming budget modification process. A lot of times government relief comes in the form of income tax credits. And because most nonprofits don't pay income tax, that's what tax exempt means. Payroll tax credits are what are more important to us. And in fact, the ERTC, the Employee Retention Something Act in the federal program did in fact use payroll tax credits as ways of supporting both small businesses and nonprofits, and it's a much more equitable and fair way to provide tax credits. And then finally, we know that government needs a robust industry and ecosystem, just like we need a robust agricultural system and supply chain. We also need that in nonprofits. And in particular, we know there are so many disparities in California that particularly funding that goes to nonprofits in rural areas, in poor areas, and communities of color are especially important for all of us. As just a couple of examples, for one of the things our research has shown is that for every dollar that a metropolitan nonprofit has, a rural nonprofit has 59 cents. That shows the disparity between how government, foundation, and individual funding is in terms of all of these. And then one last thing. I missed this. Contracts that allow nonprofits to compete for talent. The average amount that Meals on Wheels that California Meals on Wheels organizations receive for a meal delivered is $5.05 per delivered meal. And if you have a contract with the government that gives you that amount of money, the only thing you can do is push down your wages, often to a point where you can't compete with others for talent. And also that just simply isn't fair to our employees. So all of these things are the things that are important. There are some that many of you on this committee already know. So we're very happy to have you as allies to continue to work for these. Thank you very much for holding this hearing.
Thank you. Next, we will hear from Julie Baker, Executive Director, Californians for the Arts.
Good afternoon, Chairs Rivas and Limon and members of the Joint Committee. Thank you for this opportunity to speak today on behalf of arts and culture nonprofits in California and for this inaugural hearing. My name is Julie Baker. My pronouns are she, her, hers, and I'm coming today from the unceded land of the Nevada City Rancheria Nisenan, or Nevada City, California. And I'm speaking today as the Executive Director of Californians for the Arts and California Arts Advocates. There are 15,240 arts, culture, and humanities nonprofit organizations in California. Combined, these California arts, culture, and humanities nonprofits employ 74,703 people, earn more than $6 billion in revenue each year, and have assets of $19 billion. But I don't think I need to share the devastation COVID has caused for arts and culture nonprofits. I mean, in fact, it was only a year ago that we were still shut down. And it is completely understandable that major decisions need to be made in emergencies to protect the public. In our experience, though, there needs to be greater transparency about how decisions are being made when they affect entire sectors of our economy and our communities. The effects of COVID are long-lasting for the arts and culture sector. Attendance numbers are not like they were pre-pandemic now, and even though other sectors seem to be rebounding, we are not yet. In response to the closures, many nonprofits have pivoted online, but we know that without access to the right technology or broadband, as has been discussed, the opportunity to continue to provide programming outreach was not equitable. However, many could not retreat to online delivery arts programming, but had to pivot to providing other critical in-person services as well, including public health education, childcare, and food delivery. The skills arts and arts workers should be relied on during a crisis. Artists are second responders. Arts organizations and artists they engage and employ are innovative, iterative, flexible, and creative communicators. As event and public gathering organizers, too, we are trained in crowd management, public safety, and quickly building temporary structures like one-day festivals. Access to the arts will help us survive and overcome the pandemic. And as we emerge from the crisis, we will be a changed society. Investment in the arts needs to be a part of the long-term strategy to deal with the aftermath of the pandemic. Rebuilding California will require ingenuity, including a reckoning of systemic problems such as racism and economic disparity. Arts and culture nonprofits are trusted community partners. They utilize access to arts and culture and participatory arts as a means to engage youth and educate youth, build social cohesion, create empathy, and healing from trauma. These are critical services for our community. But we also learned that arts workers are a vulnerable workforce, and the pandemic has heightened this vulnerability and highlighted racial inequities. At the height of the crisis, 63% of creative workers were unemployed, 1 in 10 have experienced homelessness, and 1 in 3 have faced the threat of eviction. 55% of workers in the creative industries have no savings to fall back on. And artists who identify as BIPOC have higher rates of unemployment than white artists and lost a larger percentage of their income during the pandemic. So here respectfully are our suggestions in terms of what we have learned in these last several years and how to address some of the barriers to access for needed resources. Look to your artists as creative communicators and problem solvers in times of crisis, and look to artists and arts nonprofits to help rebuild communities as second responders after a crisis. Invest in these organizations and arts workers. Give them the tools, technical training, access to technology and equipment to be prepared and ready to serve. As the state of New York just did, let's create a guaranteed income pilot for artists. Let's fund the California Creative Workforce Act of 2021 and create a new pipeline of workers with diversity and living wages as priorities. Arts nonprofits across the state are woefully undercapitalized. We need to fund sustained general operating support and not just special one-time projects, and increase the state arts agency, California Arts Council's baseline budget from 66 cents per capita to $1 per capita. We need to continue to evaluate the impact of AB 5 on small budget performing arts organizations and look for creative solutions to support the ability to afford hiring workers with living wages for these vital community-based cultural organizations. They were not the intention of this bill, but they are the collateral damage. Grant making should be accessible and not designed for organizations with full-time professional grant makers. Grant applications need to be streamlined and made common across agencies as much as possible, and funding needs to be released as quickly as possible, as you've been hearing. In addition, grant periods should be open longer or until the funds are expended, and instead of closing on a hard stop date. Many arts organizations are understaffed or experiencing the rehiring and don't have the ability to apply within 3 weeks as often they are asked. We also suggest creating a statewide equity government grants review panel made up of people who've not applied due to either mistrust or lack of capacity to review current grant applications. Grants should always be available in multiple languages to reflect the diversity of California, but at least all services should be made available in Spanish. We need to recognize that although nonprofits provide economic impact like a small business, they are also different. And so opportunities for funding need to take into account that nonprofits are not easily characterized by NAICS codes and that fiscal sponsored organizations under a larger nonprofit organization should be eligible to apply. Access to affordable space, affordable housing, and living wages are critical issues for arts nonprofits and arts workers. Thank you for listening and for including arts and culture and nonprofits as part of the solution. Thank you.
Thank you so much. Our next speaker is Jennifer Hark, CEO. Oh, do you want to ask a question? Go ahead. Sorry, Assemblymember Gibson.
Yeah, I want to say thank you very much for your presentation. If you could please submit your testimony in writing, because I would like to extract some of the ideals and solutions that you've articulated. I think they're very good solutions. So that's the only point I want to make. Thank you very much. On point.
Thank you. We're learning so much from all of our speakers and getting ideas, maybe for future legislation or other, or, this year, this is tomorrow is our bill introduction deadline. So I know Assemblymember Gibson's already making a list here, right, of all the ideas. Yeah, I have my own list too. So thank you to all of our leaders. Next, Jennifer Hark, CEO of People Assisting the Homeless. Pat.
Thank you, Co-Chair Rivas and Co-Chair Limon and all of the members of the committee so much for inviting me to join today. My name's Jennifer Harkdeet, and I'm honored to be the CEO of PATH. PATH is a nonprofit homeless service provider and housing developer. We started back in 1983 in Los Angeles and have grown to be one of the largest providers in the state, battling the crisis of homelessness every day. We now have over 60 locations with major community hubs in Sacramento, Santa Barbara, Los Angeles, Long Beach, Orange County, and San Diego. We currently have over 2,100 affordable housing units completed or in the pipeline. And our mission is to end homelessness for individuals, families, and communities. With close to 1,000 staff serving over 25,000 individuals a year, COVID-19 impacted us greatly. Today, I want to focus on two areas for opportunity as we look at how the pandemic impacted us, as well as many others like we've heard today, and to help us prepare for the future. One area is our workforce, and the other is the contracting challenges. I will start with the challenges we've seen maintaining our workforce. Going back to March of 2020, when the lockdown occurred, we knew instantly that we were essential workers. I can still remember exactly where I was when I heard the news of the shutdown, as I'm sure many of you can as well. But what this truly meant for us was that as the rest of the world was figuring out how the implications would work with their family or how they would meet their basic needs with food and paper goods shortages, our entire team had to think through this for thousands of the most vulnerable individuals we serve, and we did. Our team set up 13 new interim housing sites in less than 6 months, many of them within days of touring the facility. We knew that it was truly life or death. However, this took a great toll on the staff with often little or no compensation increase. It's not lost on me that our sector is seeing a significant turnover. Homeless service has always had a healthcare role, and during COVID, we've really pushed that to the limit. Having staff work directly with COVID positive participants, providing testing, bringing those essential items into the community without a lot of training, without identifying what expertise they needed. As an example, we hired over 440 people in 2021. We had over 317 staff leave the organization, and we do an exit interview with every person. Almost all of them cited they were leaving our sector. And the majority, over 75% of these separations, had barely been with us a year. So we need to figure out how to invest in the staff who never gave up, who continued to provide outreach, run interim housing, and be the hope for people who often don't have any. We need to look at our workforce differently and ensure that we have the training and professional development, the wellness programs, and the flexibility that our teams rightfully deserve. And the second area we want to focus on is really preparing around our contract challenges. The first one is pay equity, and I think it really ties into the workforce challenges. Healthcare is one of the leading industries people are leaving. We need to provide a living wage where people can live and work in the same community. And our staff cannot be eligible for the same services that they offer participants. We don't want to perpetuate poverty. This has come to light even more than ever during the global pandemic. By setting annual increases for multi-year contracts and setting pay standards by regional cost of living standards, this can help retain staff in our field. Another item, as Jan mentioned, is full cost funding, truly paying for the full cost of providing the service. Often nonprofits have to fundraise to cover expenses contracts do not provide. Let's fundraise for innovation, not basic needs. During COVID, we have had janitorial costs triple in some of our interim housing and shelter facilities without any increased government revenue. Contracts need to be reevaluated for true costs. There needs to be contract advances. We should not be waiting for lengthy reimbursements. And some of our local jurisdictions have figured this out. Additionally, allowing flexibility between the line items that's been stated, especially during a state of emergency, would allow us, often the safety net in communities, to adapt to the emergency without worrying about closing our doors. We need to look for opportunities for capacity building. And I know that not everyone wants to fund capacity building, but what we've seen is that this would greatly increase our ability to respond quickly. Many of us grew during the pandemic, not because we wanted to, but because we rose to the challenge. And yet this quick growth causes a race to keep up with the infrastructure that's needed to support our programs. To summarize, we've learned so much during this pandemic and have had an opportunity to make changes now. We have that opportunity that will better prepare us for the future. So let's not get stuck unprepared again. Let's plan for the next emergency, because we know now more than ever that we will need to act swiftly and that our nonprofit sector will continue to meet the needs of our community. I really appreciate the opportunity to share with you all today. Thank you.
Thank you, Jennifer. Our last speaker on this panel, we have Dr. Leandra Clark-Harvey, CEO of the California Council of Behavioral Health Agencies.
Thank you so much. I am Dr. Leandra Clark-Harvey. I'm a psychologist and I am CEO of CBHA. We represent mental health and substance use agencies that serve over 800,000 Californians annually. And there's been some really illuminating discussion today about the services that nonprofits provide. And I'd like to discuss the people behind those services, the heroic individuals who work day in and day out to provide these essential services. So our members have braved this pandemic to provide service to so many with behavioral health needs, but it's come at a cost. It's come at a cost to their productivity, their personal safety. And many agencies are on the brink of crisis due to the very severe workforce shortages that exist. So CBHA, as a state advocacy organization, has assisted our members with grants for telehealth equipment, PPE, and constant advocacy, but more is needed. The picture I'm painting is not pleasant, but the story has to be told. And more importantly, we have to find solutions so that behavioral health, essential personnel, and our public behavioral health system are retained and recruited, and clients are served. So nonprofit behavioral health organizations are facing a unique set of challenges, and it's no surprise to many here that at the heart of it all is financing. In order to survive, our agencies exist off of various funding sources. For many, their primary funding stream comes from contracts with county behavioral health. During this crisis, some of our county partners have worked to provide flexibilities with upfront payments and negotiating contracts around reimbursement rates, but there is great inconsistency, leaving some of our members to question if they can survive off of existing rates. As has been mentioned by colleagues from other sectors today, workforce has and always will be our top policy priority. And while we are grateful for the flexibilities that have been afforded with the use of telehealth, there are also challenges. It is not the best modality for all populations. And with the surge in behavioral health technology, it warrants greater safeguards and quality control. For example, how does a consumer know if an app is good or not, or will solve their mental health or adequately indicate if they have a true mental health issue? And many private tech companies are now recruiting staff from the public behavioral health force because of poor rates and inability to pay them well. CBO staff are underpaid, they're overworked, yet the pandemic continues to create more behavioral health needs as kids go back to school and as parents transition back to work. For those agencies who are looking to become certified to provide Medi-Cal services, I've heard from many, especially BIPOC serving agencies in small areas, that some encounter barriers in a cumbersome certification process at the state level. And our state has not been the most friendly to out-of-state providers who look to transition their licenses to California in order to bolster our already lacking workforce. Last, when we look at who populates our workforce, though our nonprofits lead the way with board diversity, as been shared earlier, we need to increase this even more. So from the boards of our nonprofit organizations to the clinicians and the clients they serve. So in sum, there's a number of issues that I've laid out today, but here are some solutions. One, our providers need to have higher negotiated rate limits with their counties to account for changes to minimum wage, the dire workforce shortages, and to allow for more competitive wages for retaining and recruiting workforce. Our state should explore flexibilities and license reciprocity with neighboring states. We need quality control and assessment of behavioral health technology. We need to ensure that barriers to becoming a Medi-Cal provider are eliminated, and we need to invest in recruitment of diverse nonprofit board, leadership, and staff. Now, we realize that these solutions cannot be pursued alone, but only in partnership with our county, state, and even private sector allies. As the chairwoman so astutely commented at the beginning of this hearing, nonprofits are the heart and the backbone, but we've been left behind. And as my co-presenter on the first panel stated, nonprofits are a powerful force for equity. We are in a physical and emotional crisis, and we need our essential behavioral health nonprofit providers ready to assist us with the emotional toll of this pandemic. Thank you for highlighting the state of affairs of nonprofits.
Thank you so much. All great presentations with great ideas for us and for what the state can do better to support our nonprofits that are very critical, especially during emergencies. Next, I will open up to questions or comments from members of the committee. Assemblymember Gibson?
Yes, if I would just ask the same thing that I asked previous, if all the presenters can please submit your solutions, your testimonies to writing to the committee so that we can get a copy of it, because there's some things that I certainly want to make sure I capture, and look forward to collaborating with you on trying to address some of these issues in which you brought up. Thank you very much to all the panel.
Senator Limon.
Thank you, Madam Chair. And I would like to again thank folks. I think that, you know, listening to this last panel, certainly I feel like trying to identify how we address the issues of reimbursement rates is particularly important. Additionally, the differences. I was really struck by one of the data pieces that was shared that talked about, you know, in kind of rural communities, it's 59 cents to the dollar for what urban nonprofits get. And I may have gotten that slightly inaccurate, but I think that that's what my notes say. That's what I took down. And that's very real because there's other challenges that come. And so I know for those of us that have some rural communities, we certainly look at that as well. And we want to figure out how, even within the nonprofit sector, how we address equity issues, because the issues are certainly different. But poor is poor, whether you're in urban or whether you're in rural. If you cannot afford food on the table, the feeling is very similar, right? If you cannot afford a house over your roof, that's going to impact you as well. So I look forward to, again, in future hearings and other places where we can gather more information and kind of have a dialogue to include those two items in our discussion. Thank you.
Thank you. I, of course, learned so much from this panel, and we keep hearing the recurrent issue of reimbursement from state contracts and the delays, unfortunately, for our nonprofits to receive this funding that they have to put up front somehow, either through credit line or another way. And, you know, one of the presenters talked about offering potentially a payroll tax credit to nonprofits. We do that a lot in the legislature, where we offer tax credits, income tax credits, to industries that we want to keep in California, that we think are critical to California. You know, we want that in California, but we're not doing that for our nonprofits. And, you know, that's something, you know, I serve on the Assembly Rev and Tax Committee, so I hear these bills a lot that come through, and I think are as important, but we need to, this is one way to elevate the nonprofit sector and also consider them as important as other industries.
If you write it, I'll joint author it with you.
Oh, okay. Okay, we already have some authors here.
Indeed.
Yes, this is a great way. I had never thought of that because I was thinking, well, they're tax exempt, right? A lot of us think of nonprofits as, you know, as tax exempt, but now that reminded me, we have to still submit payroll. No one is tax exempt of payroll taxes in the state. To that, also, I thought of the importance of the nonprofit workforce and supporting, you know, like lots of other industries, this industry is also facing a workforce shortage, or, you know, people are becoming less motivated because of the working conditions and the stress that, especially during the pandemic, that they may be facing as a service provider. And what can we do to make sure that people still want to enter the nonprofit sector in California? You know, that it is a very rewarding career for all, for young people, for older people, experienced workers. So thank you for highlighting all of these issues to both panels. Next, I want to open it up to public comment. If we have any public comment on phone lines. Do we have phone lines open? Okay. Is our moderator ready if there are any calls?
Yes, if you would like to provide public comment today over the phone, please press 1, then 0. That command again, 1, then 0. And first, we will go to line 22. Please go ahead.
Chairs Limon and Rivas and committee members, thank you for supporting a conversation on impacts to nonprofits during emergency, and bravo to all of the great panelists. My name is Janine Colburn, CEO of the California Alternative Payment Program Association. We've already submitted a letter, but I wanted to touch on a couple issues specifically for the AP nonprofits. The nonprofits I'm here talking about have a state contract to support income-eligible families with enrollment and access to subsidized child care. These nonprofits, too, are contracted by 38 counties to administer their CalWORks Stage 1 child care. During the pandemic, these AP nonprofits were not provided any funding to move to virtual work environments, yet were expected to maintain continual contact with enrolled families. LEAs and others were provided funding to be closed during the emergency, and yet the AP nonprofits that had a critical role to continue meeting with families and take on the new workload of enrolling essential workers had to secure personal lines of credit in order to keep serving families. Currently, these nonprofits that are a lifeline to so many fragile families are struggling. Just as all other businesses in California, they are struggling with a huge loss in their workforce. However, their state contracts with the nonprofits prohibit them from offering such things as hiring bonuses or flexibility to increase existing staff salaries as needed. Finally, I underscore that because the APs received no help during the pandemic, the fallout is a struggle for these programs, of which some may not survive. So now we're tasked with enrolling 110,500 new child care slots from the 2021 Budget Act, 36,000 proposed in this fiscal year, and the additional 80 hours of potential COVID-related sick leave. I underscore all these and let you know that the crisis from the pandemic is ongoing. We thank you for hearing us, and we hopefully look for some support from you. Thank you.
Thank you.
Next, we will go to line 28.
Chair Limon and Chair Rivas, good afternoon. My name is Wendy Wang, representing Sycamores, a nonprofit organization with 9 locations of care throughout LA County, notably in the 39th Assembly District. Since the start of COVID, Sycamore staff have continued to provide needed mental health care, child welfare services, and support to children, young adults, and adults. Many staff have prioritized the needs of our consumers and the organization above the health and safety of their own families. Like other healthcare professionals, first responders, and teachers, our staff, in the face of fatigue and burnout, are still on the front lines serving our communities. Yet nonprofit organizations are struggling to remain financially viable. Reimbursement rate structures in the public behavioral health system under Medi-Cal and local contracting requirements hamper nonprofits' abilities to attract and retain high-quality staff in comparison to our competitors. If nonprofits are to thrive post-pandemic, there must be immediate financial assistance from local, state, and federal lawmakers to help us keep our doors open. Help us continue to offer life-saving care and support in our communities. Thank you.
Line 34, please go ahead.
Good afternoon. This is Adrian Shilton with the California Alliance of Child and Family Services. We represent 160 nonprofit community-based agencies across the state who are providing services to children, youth, and families in public human services systems. We would like to commend the leadership from this select committee for putting on such a vital hearing about the specific needs and issues of nonprofit organizations across the state. It is timely, and the discussions have been rich and important. Our nonprofit organizations have served a critical role during the pandemic, providing mental health services to students and their families when schools were closed, as an example. When most of the world closed down, our members were all operating to serve a vulnerable population that has been even more devastated by the pandemic. One specific example of where the state could be helpful in supporting nonprofits is supporting them financially as policies roll out at the state level that impact them in terms of costs. Supporting them so that they can support their workforce who are delivering these services across the state. Workforce challenges persist for our members, and so we need to explore every possible avenue to eliminate barriers to enter our workforce and to support the workforce that we have. Thank you very much.
Line 23.
Good afternoon, esteemed committee members. Eva Terraza, Vice President of Public Policy and Upper Family Services. We're a statewide children's behavioral health and foster care agency that operates in 5 geographical regions throughout the state. We are now in 2 years into the pandemic, and our employees are experiencing the compounded weight of these challenging times. They continue to heroically provide critical mental health services to children, youth, and families struggling with trauma and other behavioral health issues, and help them navigate services and resources in the social determinants of health. The needs are great, and it's a tall order for our employees to carry out. Burnout and fatigue is real, and we see its impact in workforce retention. We need immediate, intermediate, and long-term solutions and strategies to address the workforce and pipeline issues to ensure that we have and retain the linguistically and culturally diverse workforce of today and of the future. We are appreciative that COVID sick leave was passed, which we support. However, there was no funding to reimburse nonprofits for these costs. CBOs must have the corresponding funding to fully carry out this extended benefit. Finally, we are in need of robust loan repayment programs, scholarships, and regulatory relief, particularly around documentation. And we must explore every single avenue we have to support the community-based agency workforce. Thank you for the opportunity to speak today at this historic hearing.
Line 20.
Chairs Limon and Rivas, I'm Tracy Rattray from the Public Health Institute. As we've heard today, nonprofits are playing essential roles in keeping Californians healthy during the pandemic, as they have done for years. Yet, as we've also heard from every speaker, inadequate, inflexible, stop-and-go funding prevents nonprofits from operating and expanding successful programs. These programs often shut down altogether when funding stops. Assemblymember Gibson is championing a budget request of $100 million ongoing to create a health equity and racial justice fund that would provide resources to nonprofit community-based organizations, clinics, and tribal organizations to identify the most pressing inequities and injustices in their communities and tailor best practices to address them. These organizations have the trusted relationships and knowledge of community needs that makes them essential partners to address unfair, preventable differences in health outcomes. I request your support for the Health Equity and Racial Justice Fund, which would be a game changer in sustaining nonprofit organizations over the long term to advance health equity and racial justice in communities across California. Thank you.
Line 32.
Good afternoon, Chairs Rivas, Limon, and committee members. My name is Usama Muqaddam, and I'm the Director of State Policy at Public Health Advocates, one of the state's leading health and equity advocacy organizations. I'd like to first congratulate this body on this inaugural meeting and highlight the very real need for nonprofits to be supported, both through funding and infrastructure in the face of future emergencies. Our nonprofit and community-based organizations are commonly the first line of emergency response in our communities, especially in communities that are historically underrepresented and structurally disadvantaged. The COVID-19 pandemic highlighted many holes in our state structure as they relate to the line of communication established between the legislature and administration and our nonprofit and community-based organizations, and how that affected the swiftness in response and financial support for the communities at stake. Additionally, the COVID-19 pandemic exposed many shortcomings in the structure that nonprofits are forced to employ due to the lack of support at government level, often being forced to take a responsive and reactive approach to meet the emergency needs that the communities they represent face during emergency crises. What we need are proactive and long-term investments in ensuring that health equity and racial justice are achieved in the face of emergency crises. There are many bills and budget asks being highlighted this year that aim to address this increasingly important issue, and we urge this committee and its members to continue to learn and ask for help and information as you're doing today, centering the most impacted entities that this conversation affects and are lending our experiences and expertise on the ground to help meet the needs presented. We're eager to engage with this body as well as the state legislature at large to uplift the greatest barriers to community representation through nonprofit involvement in emergency response and community programs. Thank you.
Line 29.
Hello, good afternoon. My name is Dr. Wendell Bruner, and for more than 30 years, I was the Director of Public Health for Contra Costa County Health Services. I still continue to work in public health on chronic disease and COVID all around the state of California. Nonprofits are vital to the work that we do in the public sector. Partnerships between community-based organizations, local health departments, and others are essential to improve community health and to address the health inequities in our communities that the pandemic has so starkly illuminated. Yes, local health departments do need more resources to address the major health problems in our community. But we also need resources for community-based organizations. The partnership between strong community organizations and nonprofits and determined health departments is the most effective way to address the health problems in our communities and to address health inequities all across the state of California. So I'm in support of the Health Equity and Racial Justice Fund or other appropriate ways of funding community-based and nonprofit organizations to work on health and health equity. Thank you.
Line 33.
Good afternoon, Madam Chairs Rivas and Limon and committee members. My name is Benito Delgado Olson, and I'm the Executive Director of the nonprofit SupplyBank.org. SupplyBank.org works with more than 500 community-based organizations throughout the state to ensure they have the essential materials and supplies that their constituencies and people need for health and overall well-being. Since the onset of the pandemic, SupplyBank.org, First 5 California, CSD, Cal OES, FEMA, and local agencies in all 58 counties worked together to provide thousands of child care providers and nonprofits with more than 200 million items of PPE, 20 million diapers, 50 million wipes, and also additional essentials for those who were impacted by the wildfires. Without question, nonprofits stepped up during the pandemic, but government support for nonprofits are now more important than ever. Many actions are needed, and we sincerely thank you for your leadership in putting together today's event and hearing, as it is a great start. We'd like to echo the speaker on child care support and also panelist Karen Delaney's comment on the constraints that line of credits provide onto nonprofits' bottom line. SupplyBank.org and the National Diaper Bank Network are also seeking $30 million in this year's 22-23 budget over 3 years to fund statewide diaper and wipe distribution to create a statewide footprint from the existing program. We're pleased to be working with Assemblymember Cervantes on this request. As an organization, we believe our partners when they say that eliminating the physical material poverty one experiences when in crisis or displaced by a wildfire goes a long way towards ending the poverty of the spirit, enabling economic prosperity and a happy and healthy life. We thank you so much again for your leadership in creating this space for nonprofits to talk safely, and we look forward to working with you in the future. Thank you very much.
Line 35.
Good afternoon. My name is Kathy Wayne, and I am the board chair of First Responders Resiliency in Sonoma County. And I thank you, committee chairs, Assemblymember Rivas and Senator Limon, as well as the other committee members. The organization that we serve is, we cater to both retired and active first responders and their families, and it includes fire personnel, emergency medical personnel, law enforcement, dispatch, emergency room doctors and nurses, and any other essential frontline workers. Our goal is to provide a proactive, science-based approach to the psychological, physiological effects of stress and trauma in first responders and their families. We started our organization back in 2018, and we had no idea how much of an impact that COVID would have on our organization. And as you can imagine, being in Sonoma County with all the multitude of fires that have occurred over the state of California along with the COVID. As a matter of fact, one of the first COVID law enforcement deaths happened in Santa Rosa with Detective Mary Lou Armour, who died. And, the difference between responding to incidents that what you're responding to, there was just the great unknown, as well as, we see with many of the other nonprofits who spoke today, that their workers continued to come to work regardless of the chance that they could be exposed to COVID. With many of the first responders, their families are also impacted. We had many of the first responders who actually lost their homes in many of the fires. And we don't really pay attention to what goes on outside of the workplace. We know what they do on the job, but it has a great impact on their families outside. So our program benefits the families as well. And our goal is to really keep those first responders able to come to work on a regular basis. Mental health is coming to the surface, especially with first responders, and we want to continue doing that. We know that we have to serve others, but we have to serve ourselves first so that we're healthy when we come to work. Much of the funding for first responders and training, when you look at mental health, it's not mandatory. It's not mandatory training, so it's very difficult. A lot of times in budget, when you have budget difficulties, the first thing that's cut is normally non-essential training funds. So we are really looking at what we can do to better help our first responders on all levels. So thank you so much for your time. I appreciate this committee, the select committee on this topic, and we're just proud to be a part of it. Thank you.
Thank you. We have about 5 more minutes for public comment. So if there are others on the line, I'm going to ask you to be brief so we can get as many of you in. We really appreciate hearing your ideas for what we can do to better support nonprofits.
We actually have no further comments at this time.
Okay. Well, I spoke too soon, yeah. But thank you. I'll have Senator Limon provide some closing comments.
Thank you. First of all, I'm just excited that we were able to do this. I think that even with the pandemic, our schedules have changed. Our ability to do select hearings and informational hearings have shifted. And I think that that's a reflection of what so many of us are going through. It's great to be able to work with Assemblymember Rivas on this issue, who has a vast experience working in this area. And I'm excited that both houses of the legislature get to really look at this. I think that the information that's been presented today to this committee is very helpful, not just because you heard bill ideas come up immediately, but certainly also to help us thinking of what the long-term strategy is going to be. We have crises, public health emergencies happen. Certainly not something like this in our lifetime, but they will happen again. We know that. And so thinking long-term in terms of what we do to help nonprofits and where the state can play a role, and certainly talking to our state agencies, that's another area where I think that would be helpful for this committee to also talk to our state agencies to understand what the interaction is around working with our nonprofits. Do they have liaisons? Who do they go to? I mean, some of the examples given, it's very clear that while there might be financial opportunities for both small businesses and nonprofits, that if someone were to look at the application itself, it might discourage them from applying if they're a nonprofit, because it speaks to a small business and not to a nonprofit. So I hope that we will continue the conversation. A special thanks to all of our teams and staff who helped put this together, and of course every presenter who chimed in to influence, to think about, to help us think about how we move this forward. So thank you very much.
Thank you, Senator Limon. Thank you for your leadership in this committee. I really appreciate learning from you and some of the legislation that you have authored to help nonprofits in California. I look forward to also doing the same and to being the voice of the nonprofit sector here in the legislature. The members that participated today and many more members want to do more for the nonprofit sector in California. And that's why we were here today to get this started. It doesn't mean that this is going to end. This is just the beginning of what the legislature, hearing of what we can do. I'm sure we'll continue having these conversations. I want to thank Cal Nonprofits for helping us organize this hearing and for promoting it to nonprofits across the state. Thank you to all of us that joined us today from everywhere, every different parts of the state. Thank you to my team for organizing this hearing. Without them, we wouldn't be here today. And so thank you, and please continue. If there's someone watching that has ideas, please reach out to us. We will continue to have these hearings in the future with other topics, and we really care about the nonprofit sector, and most of all, what the state can do to better support the nonprofits that serve our constituents. So thank you very much.